Sorry, and it's time now for the midday edition of NBT World Brief on NBT and NBT World. I'm Surapan Lautharanarit. The government has sent a representative to visit victims injured in the train and passenger bus collision, while assuring full support for medical treatment and compensation. Following the train and passenger bus collision, Minister attached to the Prime Minister's office, SUPAMAS Isarapakdi, visited injured victims and delivered a message of concern from Prime Minister Anutin Chanvirakul. Her first stop was Midday Hospital, where 7 injured victims were admitted. Doctors have allowed 3 patients to return home, while 4 others remain under close observation. The minister later visited Jairak Hospital to encourage another injured victim, while also presenting a care package and instructing medical staff to provide full treatment and support. Minister SUPAMAS also reassured relatives that the government is concerned about the incident and is coordinating with relevant agencies on medical rights and compensation measures to ease their concerns and allow victims to focus on recovery. Her final stop was Chulalongkorn Hospital, where she and Director of the National Broadcasting Services of Thailand, Tasaniyaporn Dwangkeo, visited another injured patient suffering facial injuries, broken ribs, and a fractured leg. The patient remains conscious and able to eat, while doctors continue close monitoring. Bangkok's governor has ordered an urgent review of railway crossings across the capital following the train and bus collision, while coordinating with related agencies to improve traffic safety measures. Bangkok Governor Chacha Sittipan said the Bangkok Metropolitan Administration, or BMA, has instructed its Traffic and Transportation Department to review all railway intersections across the city following the train and bus crash. He said officials are checking whether all traffic signs and warning markings are properly installed, with an update expected by noon today. The governor explained that the accident site is highly complex, with frontage roads and multiple connecting routes contributing to heavy congestion. He added that the city must coordinate with several agencies, including the Royal Thai Police and the State Railway of Thailand, to improve road surfaces and traffic signal systems. Some traffic lights have already been installed at certain locations, but may not yet be fully operational. Regarding traffic discipline, the governor said the BMA will focus on public awareness campaigns and providing recommendations to motorists, while law enforcement remains the responsibility of police authorities. On the Prime Minister's proposal to build tunnels at railway crossings, the Bangkok governor said similar railway elevation projects had previously succeeded along the Vipawaddi-Rangsit route. The governor noted that authorities are considering 2 options, either elevating railway tracks or constructing underpasses, but warned that tunnel projects require careful consideration because of road gradient limitations.
สั่งให้สสทบทวนจุดแยกทุกจุดนะว่าเรามีการทำไอ้ตัวเครื่องหมายต่างๆได้ครบถ้วนไหมเช่นสีเหลืองทะแยงซึ่งเดี๋ยววันนี้ก็จะมีประมาณตอนเที่ยงได้มาอัปเดตกันจุดที่เกิดเหตุเนี่ยเป็นจุดที่มีความซับซ้อนด้วยเพราะว่ามีถนนคู่ขนานและบางทีมันมีรถที่จะทะลุไปอีกฝั่งหนึ่งอ่ะแล้วก็เบียดซ้ายแล้วก็จะเบียดเข้าขวาอีกทีนึงทำให้การจราจรติดขัดก็ได้สั่งให้ทบทวนไปแล้วแล้วก็ให้มาอัปเดตว่าทุกทางแยกในที่มีรถไฟตัดแล้วก็จุดเสี่ยงอื่นด้วยน่ะมีตรงไหนบ้าง
ท่านนายกบอกว่ามีแนวคิดที่จะขุดอุโมงค์ลอดจุดตัดที่จุดเกิดเหตุด้วยอาจารย์มองไงบ้างครับ
ผมว่าก็มี2 ทางยกรถไฟหรือเอาถนนลอดก็คงต้องพิจารณาแต่ถนนลอดมันก็เป็นเรื่องที่ดีแต่อาจจะมีเรื่องระยะสโลปอ่ะเพราะว่าถนนมันมีเพชรบุรีตัดใหม่ที่อยู่ใกล้ๆด้วยไม่แน่ใจว่าไอ้สโลปมันจะไปชนกับเพชรบุรีตัดใหม่หรือเปล่าหรือไม่ถ้าเกิดแต่ถ้ายกทางรถไฟผมว่าก็น่าจะเป็นทางเลือกอันหนึ่งที่จะลองพิจารณาเพราะว่ามันอยู่ในโครงการอยู่แล้วด้วยซ้ำผมว่านะ
The Bangkok Mass Transit Authority and the Labor Ministry are moving forward with compensation measures for victims of the train and bus collision, while confirming support for medical expenses and financial assistance for affected families. The Bangkok Mass Transit Authority, or BMTA, expressed condolences to the families affected by the train and bus collision and pledged to take full responsibility under humanitarian principles and the law. The agency said it is coordinating directly with the insurance company and the Road Accident Victims Protection Fund to cover medical expenses and accelerate compensation payments for victims and their families. Initial compensation for fatalities has been set at 1.5 million baht per person, while injured victims will receive initial assistance of 80,000 baht, with compensation capped at 500,000 baht per person. The BMTA added that officials are closely monitoring the victim identification process and coordinating with relatives of the deceased to speed up compensation procedures, while promising transparent disclosure of compensation details. Meanwhile, the Ministry of Labor reported 8 deaths and 32 injuries from the incident. For insured workers under Section 33 of the Social Security System, medical expenses during the first 72 hours will be covered by the Social Security Office. If further treatment is required, hospitals will coordinate transfers according to medical assessments. Patients unable to work under medical orders are also eligible for income compensation at 50% of wages, or 291 baht per day for up to 90 days. For self-employed workers insured under Section 40, treatment can be accessed through Thailand's Universal Healthcare Scheme, while compensation for hospitalization will be provided at 300 baht per day, or 200 baht per day for home recovery with a medical certificate. Following the train and bus collision, the Department of Mental Health is urging the public and media to avoid sharing graphic images, warning of possible psychological impacts on victims and the wider public. Mental health support teams have also been deployed around the clock. Director General of the Department of Mental Health, Dr. Kittisak Aksarawong, said the agency is asking the public and media to avoid publishing or sharing photos and video clips from the incident, especially graphic images involving injured victims or fatalities. He also urged media outlets to avoid interviewing relatives or affected individuals while they're still grieving, warning that repeated exposure to violent scenes may increase stress and emotional trauma. The Department of Mental Health has assigned Mental Health Crisis Assessment and Treatment Teams, or MCAT, to prepare personnel and support systems for those affected by the incident. Officials are coordinating closely with local agencies, and preliminary assessments indicate the situation remains manageable and is gradually improving. 6 MCAT teams from several mental health agencies have been deployed to provide continuous psychological support, while hospitals and forensic institutes are also assisting injured victims and families of the deceased. The government is inviting the public to help care for homeless and vulnerable people through a new foster family program aimed at improving the quality of life and reducing social inequality. The Department of Social Development and Welfare, under the Ministry of Social Development and Human Security, has launched the Foster Family Project. The program allows households to provide care for homeless individuals, with the government offering financial support of 5,000 baht per person each month. Social workers will also conduct monthly home visits and provide close consultation and assistance to ensure proper care. Applicants' requirements include, for example, being at least 20 years old, holding Thai nationality, being in good health, and having suitable housing and the ability to provide long-term care. Applications can be submitted at local social development and human security offices or protection and quality of life centers nationwide. More information is available through the ministry's hotline 1300, which operates 24 hours a day. The government says the project aims to strengthen social welfare, improve the lives of vulnerable groups, and help reduce inequality in the long term. And that's the end of our midday edition of NBT World Brief. You can stay updated with the latest developments right here on NBT and NBT World. And for more stories, simply scan the QR code on your screen to access our full coverage across all media platforms. Have a good day. สวัสดีครับ